Questions?
Governor, the CDC recommending states give the COVID vaccine to all people over the age of 65. What is the state's plan to do that?
Well, obviously, we take our guidance from the medical group that we put together here in Massachusetts, and as the CDC changes their guidance or their advice, it's really more what it is, we usually turf that to the group we've had working with us on this and see what they have to say, and that's what we'll do.
A lot of states are already doing that, though. Why is Massachusetts not further along?
Well, part of our goal here is to make sure that we preserve and protect our healthcare system, which is a big part of how we manage to make sure that no one who needs to be cared for doesn't get cared for during this. And I'm incredibly proud of the fact that both in the spring and through this process so far, we have done, I think, a very good job of making sure that people who need to access the healthcare community and get their services can. Second thing we wanted to do is focus on those populations that are most at risk of COVID-19, and that started with long-term care, skilled nursing facilities, both residents and staff, and that's been a primary focus of ours for just that reason. Third group, first responders, folks who are out in the community all the time, in many cases, no idea who they're coming in contact with or what that contact might mean for them, wanting to make sure that they are taken care of. Folks in congregate care, assisted living, senior living, the folks who in many respects represent yet another population that's most at risk when it comes to COVID. I think the recommendations that was made by our group are appropriate, and I think folks over the age of 75 are part of the beginning of group 2.
How often does that group get together, and how often do they contact you?
They get together on a pretty regular basis. I don't know if it's every week or every other week, but it's pretty frequent.
How often do they get in touch with you with what they
We ask them questions, they answer them.
Governor, last week we asked about if the timeline would change. Obviously, we were hearing the Biden administration wanted to accelerate. Now it seems like Warp Speed wants to do it. The average person, April seems a long ways away. Realistically, do you think they're going to start seeing the vaccine March?
I hesitate to get too far ahead of the distribution process because, frankly, at this point, we're typically hearing when the next dose is coming a couple days before it lands. So if we don't have 20 or 30 days worth of visibility into what the distribution plan looks like. So it's very hard for us to make predictions about where we're going to be a month from now. If we're only hearing what our next dose is going to look like 2 days from now, the farthest I'm willing to go out is, a few days, because I think it's critically important for us not to overpromise on this stuff. What I will say is we have, many governors, including me, have urged the feds as they think about this distribution plan going forward, and especially as they get used to the production plans they're getting from the current approved vaccine manufacturers, that they should try to get a little farther out there with respect to how we would go about both planning for capacity to make sure we have the distribution capacity we need in place and can anticipate will be available when vaccines arrive, but more importantly, it gives us the ability at that point to start making projections on this stuff. But if we're only going to know every couple of days in advance of what we're actually going to have, I'm not going to go any farther than that with respect to predicting any of this.
Can the timeline change that quickly, though? Could it change just as fast as the doses?
Give me a for instance.
For instance, like if we start to get inundated with doses, can we start accelerating?
Yes. Look, we will move as quickly as the distribution plan moves. Yeah.
Governor Baker, there are a lot of Massachusetts residents on edge, not just because of coronavirus, but of these reports that there could be violence conceivably in every state by pro-Trump groups, militant groups. State House could be a target. You've been very critical of the president. Are you concerned at all about security in Massachusetts?
So we've been talking to our colleagues in local law enforcement, at the Mass State Police, and at the federal level on a very regular basis now for months. And we continue to engage with them based on the intelligence they gather and what they know and what they expect and anticipate. And that process is going to continue. And obviously, there are lots of conversations going on between federal, state, and local law enforcement over the issues that have been raised with respect to this weekend. I can tell you at this point in time, we are not aware of any specific threat that involves anything here in Massachusetts.
And you're in touch with the FBI and all your federal
Yes.
partners, and this is the Fusion Center.
Yes, exactly. It's all,
Can you just go over how that works a little bit?
so the Fusion Center, which was, there are a number of them all over the country, and they were created in the aftermath of 9/11, when issues were raised about whether or not, in fact, every level of law enforcement was talking to each other or not. And the Fusion Center, to some extent, works sort of the way the bunker does out at MEMA, in the sense that, you know, there are always people there, and depending upon what the incoming information is, the number of people goes up or goes down. In this particular case, a lot of this is being done virtually, but you get the idea. The Fusion Center's been very active in dialogue and conversation over what people are hearing, learning, and discovering, either through social media or a wide variety of other contacts about what is out there in the, you know, sort of atmosphere. And we rely on that information to make decisions about how we stage and deploy our resources, and how local law enforcement does as well. But these are not conversations between people who don't know each other. These are conversations between federal law enforcement agencies, local law enforcement, and state law enforcement, who talk to each other all the time. And I think for all of us, it's been an incredibly valuable tool in helping us anticipate where we need to be and when we need to be there. And as I said, we've been doing it pretty much all the way through calendar 2020.
Are you confident the State House will remain secure?
There are currently no known threats with respect to the State House or any other public building at this time in Massachusetts. And we will continue to monitor and track the information that's out there, and we will be appropriately prepared for anything that might happen. But beyond that, I'm not going to speak to the plans with respect to where we're going to put people or how we're going to do it.
Are you confident in those plans?
Yes, very much so.
I just want to follow up on Sarah's question about the vaccine timeline. Retrospectively, are we where you thought we would be at this point?
So you may recall that I said, you know, back in December, that I expected that the early part of this rollout would be bumpy, and it's more than lived up to my expectations with regard to that. But that's partly because there was a lot of debate and discussion about, you know, how long the manufacturing process would take to ramp up, how the distribution model would work with respect to both the vaccines that would be delivered directly to providers, but also the program the Fed's put together to serve seniors, long-term care, nursing home facilities, assisted living facilities, places like that. I think the biggest issue, if you were to say to me, you know, what have we been talking primarily to the folks at the federal level about, it's this issue about a window, right? How much visibility can you give us so that we can plan accordingly with respect to what's coming next? The last thing we want to do is open up a whole bunch of sites and have a whole bunch of people there and not have vaccine available to actually serve people. And I do believe that as the manufacturing process is ramped up, they've gotten better about understanding how much they can expect in their pipeline, which will then affect how they respond to us. But I certainly expected from the beginning that getting this started would be bumpy, but that once the flywheel gets rolling here, and we get the rest of the mass vaccination sites up, I mean, we put up 119 sites for first responders in less than a week, okay? Because we knew the vaccine was going to be there, and they were next on the list. And I think in many ways, one of the great opportunities here, if we can get a little more visibility into, you know, a couple of weeks or 30 days, the ability to then plan accordingly with respect to flexing our capacity to vaccinate people would get much better.
Governor, is there any appetite for maybe moving teachers up the prioritization list, given that Boston is going to laid out a plan yesterday to get students back into school? Other districts are trying to do that, and that's been a long-time goal of your administration.
We believe that, first of all, school, by every study that's been done, is one of the safest places kids, adults can be. The pooled testing program that we've been working with our colleagues at several labs here in Massachusetts to develop has actually been enthusiastically received by many school districts. And we hope and anticipate that by the end of this month, we'll have some people doing that and using it as a tool to bring kids back into school and get kids back into the classroom.
Governor, you're working with the feds. Llewellyn said that he was trying to see if anybody here was planning any activities in the capital to turn into right. Are you pushing any agenda to try to make sure that whoever was responsible doesn't, as a preventive measure, to make sure that they're not doing something in the future?
Well, there's a lot of conversation going on between, when I talk law enforcement, I'm not just talking regional law enforcement when I talk about the feds. I mean, the feds are very actively involved in following all kinds of leads and investigating all kinds of people who've been identified who were part of that travesty that took place in Washington last week. And obviously, if any of those roads lead back to people in Massachusetts, I fully expect that those folks will get arrested and prosecuted, as they should be.
Do you anticipate activating the National Guard ahead of the inauguration or around the time of the inauguration, as you've done recently at other times of hate protest activities?
Look, we only, first of all, the great thing about the Guard is when you call, they come, okay? And we only use them when we've had conversations with our colleagues at the federal level, local level, and with the state police that dictate that whatever we believe may be occurring is appropriate to activate the Guard. And we would only do so if we felt that. At this point in time, we do not have in front of us anything that would justify activating the Guard.
Last question.
Sorry, Governor, are you going to be using facial recognition technology through the Mass RMD in order to help identify some of the people who may have been at the riots at the Capitol last week?
So that is an ongoing, that process is ongoing between state and federal, and again, local law enforcement. But one of the reasons I was so aggressive about maintaining access to that facial recognition technology was because I believed it was an important tool for dealing with issues like the one that took place in Washington last week. And I'm glad that we are still able to use that technology here in Massachusetts within a framework that we in the legislature all agreed on.
Governor, with regard to these governors have a call with Vice President Pence upcoming, how much do you anticipate discussion going around the appointment amendment to happen?
I'm sorry, say that again?
I believe the nation's governors have a call with the Vice President upcoming, and I was wondering how much do you anticipate a conversation about the 25th Amendment, about potentially invoking the 25th Amendment?
I think most of this conversation, I'm not sure who's going to be on it, but I'm pretty sure most of that dialogue is going to be about the vaccination rollout program and a big push on our part to get more visibility into this so that we can plan more forward on a more forward-looking basis and put more shots in people's arms when vaccine becomes available.
Thanks, everyone. With regard to unemployment, we've still gotten a number of complaints recently where people saying that the system is slow, they call in, they can't get anyone on the phone. Do you have any update or any advice for people who are in a situation where they can't get a response to their complaints?
So on unemployment, first of all, Massachusetts served over 1 million people so far here in the Commonwealth through the UI program that was developed jointly by the federal government and by states. And I think the most difficult part for us in this whole process has been separating people who deserve those benefits from people who are part of these very large global enterprises that are basically frauding the system and trying to steal from the taxpayer and from the people here in Massachusetts who are entitled to those benefits. The two things I've discovered through actually stuff that I've done through my own office to follow up on this is, number one, if you work for an employer who participates in the unemployment insurance system, make absolutely sure that the name of your firm that you work for is the same name that your employer is signed up as a participant in the unemployment system. And the reason I say that is it's not always clear that if you work, for example, for a company that has 3 or 4 franchises, right? The company name that actually shows up in the unemployment insurance system, in many cases, is not the same name as the franchise brand. You know, it could be the Baxter Group, for example, that has a bunch of different retail establishments that operate under a franchise name. If you put in the franchise name, your unemployment claim won't process because the name the unemployment system is looking for is the name of the Baxter Group, because that's where you show up as a participating employee of that employer. So, and I can't tell you how many of these, when I've been pulling the string on them, all come back to the fact that the name, the employer name that was in the system was the wrong name. So that's point number 1. Point number 2 is if you are having trouble on this, you can always call our constituent service office. We've processed with our colleagues at the Division of Unemployment Insurance lots and lots of these questions that people have had. And the final thing I would say is part of the reason this takes a little longer than people would like, and I get how difficult this is for everybody, is because of some of the checks that we put in place to make sure that you are in fact who you say you are, that you work for who you say you work for, and that you aren't part of this global fraud process, which has created havoc for many people who are trying to access benefits they're entitled to. But it's critically important that we do all we can to make sure that you are who you say you are, because if we get this wrong, it's money that gets taken away from people who deserve it and are depending on it.